So now, I should be clear on this as an academic that I do not per se work on the issues of health. I am not an expert, nor am I a lay person on that issue. I do work around the issues of health. I'm interested in the issue of health, but I have not worked on that. I work on the issue of migration, on the issue of displacement. So the backdrop to that is the developmental agenda, the poverty issues, the conflict issues. These are the issues that I work on. One can very definitely say that it is the social context that determines the health of a person as a general individual and as a collective health issue also, both in preventive as well as in curative. And I think the medical science must take note of this, because I would say that almost 80-90% of the issues that you find in health are the issues that have their roots outside of the health sciences. They are usually rooted in societal causes. And I think that should be explored far more deeply than what it is done today. For instance, let's take migration. So now migration in our country, the 93% of our labor force is in what we call the informal sector. Almost 300 to 400 million, I think, migrate for work on daily wage labor. Maybe to nearby towns, maybe to faraway towns, but they do have to migrate because there is no livelihood which can support them in their own locales. So when they migrate, they take their bodies, and the change of environment, work stress, physical labor, poor working conditions cumulatively have a massive impact on their health. Had the economy been different, they would not have migrated. So there are very specific, I suppose, issues which can be linked directly to this phenomena, especially weakening of bones, joints. I would say lung-related diseases are the diseases which have also some carriers. For instance, one can carry a disease from here to there, and so on. So these are something that are directly linked to the kind of labor conditions that we have, the kind of livelihoods that we have, and the context of the economy which forces people to migrate for work. So many of those issues of health related, these are located therefore directly outside what happens. So health part may just look at the curative side of it, but the preventive side of it cannot be looked at unless these factors are taken into account. Also, there is another thing that in India we have a complete absence of the universal health care. There is no commitment to the universal health care as of now, and that's another issue that is completely, I think, outside the purview of the at the moment of the healthcare practitioners. This is very strange, because in most of the developed countries, universal health care is one issue along with water and sanitation that they have sorted out years ago. I think we are the ones who have not sorted that out. We have an issue here. Look at Europe, look at Canada, look at Basque, Spain. They have one of the finest universal healthcare systems as a matter of right given to the citizens. So had that even been there, then I think even this migration could have been handled. Migration is just one small issue as a pointer. There are many larger issues which we can look at. For instance, Canada, the healthcare, what I understand of the Canadian healthcare system is that they have managed to deliver a system to the citizens where citizens' health care is completely underwritten and taken over by the state. And this they have managed to do despite the fact that there are private hospitals in Canada, there are private companies in Canada, there are insurance companies, but they have managed to create a viable healthcare delivery system for citizens. Taking into account who the citizens are, and citizen as a term is important, they are not discriminated there. Every citizen of Canada is entitled as a matter of right to a universal healthcare system. We should not gradually but immediately move to universal healthcare system, because we can't, if we have to have good developmental indicators, then universal healthcare and universal education are non-negotiables. I would say that do not forget the public, and the public is very amorphous, fragmented. It's not a homogeneous whole. There are quite a few fissures there, and one should understand the public with sensitivity before get into any kind of prescription. And one should also, I think, underscore the fact that it is, after all, the constitutionally mandated thing for the state, that it is the public finance and the public money that finally drives everything, and therefore the public, in that sense, the people, I would say, not the public but the people, have to be immensely respected for who they are. And without being judgmental about anything, the students should be sensitive to all these issues before they even start thinking in terms of issues of health, because issues of health, mostly, I would say, even issues like very unresearched in terms of the causes, area of cancer, for instance, we do not know what causes cancer, but we do know certain things about cancer, or about cardiac diseases, or about lung diseases, which definitely have their roots into malnutrition, into poverty, into many of the practices that are completely outside the purview, which are rooted completely in the economic policies and the societal context.